Hi, Emma. Can you explain the structure and components of the vertebral column?
Of course. The vertebral column, or spine, is a crucial structure in the human body, composed of individual bones called vertebrae. These vertebrae are connected by ligaments, joints, and intervertebral discs, which allow for movement and flexibility while providing stability. The intervertebral discs, made of fibrocartilage, serve as shock absorbers and facilitate the spine's flexibility.
What are the different sections of the vertebral column?
The vertebral column is divided into 5 sections, each with distinct characteristics and functions. 1. Cervical vertebrae, C1, C7. These are the smallest and lightest vertebrae located in the neck. They support the skull and allow for a range of head movements. The first cervical vertebra, known as the atlas, supports the skull and allows for nodding movements. The second vertebra, the axis, has a unique structure called the dens, which acts as a pivot for the atlas, enabling head rotation. 2. Thoracic vertebrae, T1, T12. These vertebrae are larger than the cervical vertebrae and have facets for rib attachment, which provides stability to the thoracic cage and protects vital organs like the heart and lungs. Each thoracic vertebra has costal facets for rib articulation and long, downward-sloping spinous processes. 3. Lumbar vertebrae, L1, L5. These are the largest and strongest vertebrae, designed to bear much of the body's weight. They allow for significant movement and flexibility due to their large vertebral bodies, which are kidney-shaped. The lumbar vertebrae have short, stout spinous processes for muscle attachment and a triangular vertebral foramen to accommodate the lumbar enlargement of the spinal cord. 4. Sacrum, S1, S5. The sacrum consists of 5 fused vertebrae that form a triangular bone connecting the spine to the pelvis. It supports the weight of the upper body when standing and walking. The sacrum features the sacral promontory, which is the anterior projecting edge of the first sacral vertebra, and the ali, which are wing-like projections on either side. 5. Coccyx, Co1, Co4/5. The coccyx, or tailbone, is formed by the fusion of 4 to 5 vertebrae. Though it is a vestigial structure, it serves as an attachment site for various muscles, tendons, and ligaments that contribute to the function of the pelvic floor.
What are the main parts of a typical vertebra?
A typical vertebra consists of several key components. 1. Vertebral body, corpus vertebrae. This is the main weight-bearing part of the vertebra, filled with spongy bone and red marrow. It provides structural support and helps bear the body's weight. 2. Vertebral arch, arcus vertebrae. This arch forms the vertebral foramen, through which the spinal cord passes. The vertebral arch comprises the pedicles and laminae. 3. Pedicles. These are short, thick processes that project backward from the vertebral body and connect it to the laminae. 4. Laminae. These are flat plates of bone that form the posterior part of the vertebral arch, completing the vertebral foramen. 5. Processes. These include the spinous process, transverse processes, and articular processes. The spinous process projects dorsally from the junction of the laminae, the transverse processes extend laterally, and the articular processes project upward and downward to articulate with adjacent vertebrae.
Can you elaborate on the specific features of the cervical vertebrae?
Certainly. The cervical vertebrae have unique features to support their function. Atlas, C1. It has no body or spinous process. Instead, it consists of an anterior and posterior arch and large lateral masses. The atlas supports the skull, allowing for nodding movements. It articulates with the occipital condyles of the skull via the superior articular surfaces. Axis, C2. It features the dens, a peg-like structure that projects upward and acts as a pivot for the atlas, allowing for head rotation. The dens is secured by ligaments that prevent excessive movement. C7. Vertebra prominence. It has a long, prominent spinous process that is easily palpable through the skin. This vertebra serves as an important anatomical landmark.
What about the thoracic vertebrae?
The thoracic vertebrae are adapted to support the ribs and protect the organs of the chest. Each thoracic vertebra has costal facets. These are smooth surfaces on the vertebral body and transverse processes where the ribs attach. Long spinous processes. These processes point downward and overlap each other to some extent, providing additional stability to the thoracic spine.
And the lumbar vertebrae?
The lumbar vertebrae are robust structures designed to bear the body's weight and enable movement. They have large vertebral bodies. These are kidney-shaped and designed to support significant weight. Short, stout spinous processes. These processes provide attachment sites for the muscles of the lower back. Triangular vertebral foramen. This shape accommodates the lumbar enlargement of the spinal cord.
What is the sacrum, and what are its functions?
The sacrum is a triangular bone at the base of the spine, formed by the fusion of 5 sacral vertebrae. It connects the spine to the pelvis through the sacroiliac joints. Key features include promontory, the anterior projecting edge of the first sacral vertebra. Alae, wing-like projections on either side that articulate with the ilium of the pelvis. Foramina, these openings allow nerves and blood vessels to pass through. The sacrum provides structural support and stability to the pelvis and contributes to the formation of the pelvic cavity.
Finally, what about the coccyx?
The coccyx, or tailbone, is the terminal part of the vertebral column, composed of 4 to 5 fused vertebrae. Although vestigial, it serves as an attachment site for various muscles, tendons, and ligaments that contribute to the function of the pelvic floor. The coccyx helps to support and stabilize a person when they are sitting.
Thank you, Emma. This detailed explanation really helps in understanding the complex structure of the vertebral column.
Thank you for listening. If our podcast has been valuable to you, we would greatly appreciate it if you could leave us a 5-star rating and write a review on Spotify and Apple Podcasts, or subscribe, like, and share on our YouTube channel. Your support helps us greatly with discoverability. We hope to see you soon.